Whatever the politics, today's decision was a victory for people all over this country whose lives will be more secure because of this law and the Supreme Court's decision to uphold it.
A landmark decision today from the Supreme Court on President Obama's health care plan, and it is a big win tonight for the president. Good evening. I'm Shannon Kay.
I'm John Shaman. Kelly Dunn and Michael Williams have the evening off. Welcome to our special edition of News Channel 5 at 5:30, dedicated to today's ruling on the health care reform law.
A divided Supreme Court today supporting the centerpiece of President Obama's health care reform law, upholding it as the law of the land now. The court upheld the individual mandate, which forces Americans essentially to buy insurance or pay a penalty. The court is now calling that a tax. The High Court rejected a mandatory expansion of Medicaid, meanwhile, saying that the federal government can ask states to provide new benefits. However, they cannot throw those states out of the Medicaid system if they don't comply. Conservative Chief Justice John Roberts joined the court's liberal wing for a 5-4 majority vote today.
In the next 30 minutes, we will take a look at how this ruling will impact you and the political race in this election year. We have a team of experts here to break down the Supreme Court's decision and what it means for the future of health care. And we're also answering your questions. Molly Reynolds, our social media guru, monitoring the social media sites, and she'll ask your questions to our panel of experts. You can just post them to our Facebook page or tweet WPTV.
So a truly interactive half hour coming up. It should be very exciting. We're joined right now. It's a privilege to have Judy Goodman, who is a public policy attorney, and Gerald Humphrey, who is the CEO of Wellington Regional Medical Center, here with us in the studio. We're going to begin tonight by asking, in general, what does this ruling today mean for the average person? Judy, let's start with you.
Well, it's certainly landmark. It's a historic day because millions of people are now going to have access to health care that didn't have that access before. It really changes the whole thing because we are going to allow people to have access in a way for coverage and not turn them down for having pre-existing conditions. That is really very major. And certainly here in Florida, where a third of our budget is currently spent on Medicaid, the way the court ruled allows us to have more flexibility from a statewide fashion to sort of tailor this in a way that's done on a statewide level rather than make it come down from the federal side. So it really, in a sense, keeps the difference between federalism and states' rights quite intact.
Mr. Humphrey, obviously this has been talked about now for 2 years since its original passage, so you guys have obviously been trying to figure out how it relates to the average medical center.
That's right. For the most part, John, it's going to be business as usual for us. We're going to continue to take care of our patients in a high-quality, very caring fashion. But as Judy alludes, over time, we're going to see more people that have now access to health care coverage, and we would hope to see that they seek health care in a lower-cost, high-quality setting rather than our ERs, for example, which is a very high-cost area to treat primary care.
In fact, won't ERs change the way they do business? Many of them now, patients do come into the ER. You cannot turn them away. You have to treat anybody who walks in the door. Will hospitals now be able to say, you're not critically ill, we don't have to treat you here, you have insurance, go see your primary care provider?
Yes, absolutely. And we actually can do that now once we've stabilized the patient and determined they're not in an emergent state. We can make that offer to them, but now that they'll have coverage down the road, it'll be much easier for them to get access to those primary care clinics.
All right, I think we've got a lot of questions from folks who want to know, well, how is this ruling going to impact you? Let's turn things over to Molly Reynolds. She's following this action on social media. She's joining us live from the newsroom. Molly, it's a really hot topic today, is it not?
All right, John, to say the least. And as we've been getting a lot of questions, everyone's in a different situation. You've been talking a lot about patients and how this ruling will affect patients. I have a question on our Facebook page from Jeff Gerlich, and he's asking, how will this affect the medical field from doctors to x-ray techs? And how much more can the insurance go up if it has already gone up 100% for me? So which one of our experts want to take that one?
Mr. Humphrey?
Well, I think one of the infrastructure issues that has to be sorted out are these insurance exchanges that each state's going to now be required to establish. And the hope is through those exchanges, people will be able to obtain insurance at a very reasonable rate. And that will allow them for the coverage that we're talking about for these uninsured today.
The state of Florida has not actually been at the head of the pack
Right.
in setting up an exchange.
They're
so-
woefully behind, in
Well,
fact, because
they are
Rick Scott and Pam
behind.
Bondi didn't think this was going to happen, right?
Well, they did sort of put their political capital in the direction that didn't prevail today, so clearly those are partisan issues that are now moot. But what we have is a wonderful opportunity in front of us to either do the exchange correctly, or even if the federal government comes in and does the exchange for us, it is a way for transparency for people to buy insurance on an exchange in a way that they will see the pricing, and it clearly will not make it in a way that it's not affordable if they have a pre-existing condition. So the huge amount of people that will affect here in Florida, we currently have perhaps 3.5 million people
Right.
that are uninsured. So if you get 3.5 or 4 million new people that are going to have some opportunity to have coverage, that's wonderful for hospitals, and it is wonderful for doctors, provided they will be accepting of that type of coverage. Now clearly that is part of the detail,
Right,
Rob,
the
as
back
to
and forth.
as to whether doctors, and clearly hospitals has signaled today on the those who are investor-owned systems, their shares of stock went way up, so they clearly are very happy at the concept that more people will have coverage. That in the past came to the hospital without coverage, and these are people that were self-pays or in most cases no pays.
I was going to say, have we seen anything from the insurance industry guiding us as to how this could...
Well, in the insurance industry, the marketplace showed a little flux today, but most of the prognosticators suggest that pre-tax margins are about 7% profit for insurance companies. Now, maybe they would have liked it much higher, but I think in this market, 7% pre-tax margins are terrific.
Do you think the 2 million of the 3.5 million Floridians who you said were uninsured just a moment ago will likely be covered now by Medicaid with this expansion that they talked about today?
Yeah,
That's really going to put a burden on. Are
Well,
you guys worried about that?
Yes, because obviously a third of the state's budget is currently Medicaid. But one of the beauties of what was done, the elegant solution that Justice Roberts crafted in the majority opinion, suggests that the state will not be penalized if they wanted to opt out and just take whatever the Medicaid currently, the allocation currently is. They could, and they could then perhaps craft something that would be as simple as doing something that would be what they call a block grant, which many of the political party people have suggested would be the way they would want to do it. It gives them that option. I would hope that the train is moving forward and we try to push cross-sector conversations in a way that we understand that all people need to be covered in a way that we could push costs down and put the attention on preventative care and less costly ways of delivering that care, so that even a simple thing like bringing obesity down and better diabetic control would have enormous impact on keeping health costs lower.
Likely see more programs like that
That's
popping
right.
up.
Good information, more information to come. Our special edition of News Channel 5 at 5:30 continues.
How today's decision will change